we're recording this mid-November 2020. So we're in the middle of COVID-19 crisis. And I think, when COVID-19 hit us, it was tough on a lot of organizations, but I can imagine hospitals very specifically for many reasons had a lot of challenges, and challenges equal opportunities, but still. So can you talk a little bit about your experience in terms of IT and digital challenges?
Absolutely. You're absolutely right. When COVID-19 first came about in February, March time, for us, when lockdown came on the 23rd of March, it was about how do we transition our services to still be able to provide services to the patients who need them, but still protect our staff and patients in those scenarios. Now, luckily for us, it was about our state of readiness. So we had staff who needed to be shielding, we had patients that were shielding, but still needed to access clinical services on an ongoing basis. So for us, it was about how can we marry the two with protecting both staff and patients at the same time. So we moved a lot of our services to remote services, virtual services, which is a huge challenge, as you can imagine, both from a technical digital perspective, but also change management. How do we get our clinical staff to start thinking about using digital in a different way? Whereas before, it would have been difficult to put that change in place. But what we've managed to achieve is, I'd say, 3 years of transformation in about 3 months, which is an amazing feat to look back on and see that change come through. So we managed to stand up, and I think it was down to some of the good work that we'd already done. We managed to stand up remote services using Awingu for our staff. So we were ending up having something like 1,000 staff using Awingu, enabling them to work from home, access clinical systems, use our virtual consultation platforms to talk to patients, giving staff more devices to enable them to do home working. And then how do we manage those patient relationships as well in terms of that digital and making sure that they were included? So in some cases, virtual consultations don't work for certain patient groups, which is fine. So how do we still enable them accessing services through telephone, etc.? So it was a huge challenge, and it was a lot of hard work from a lot of services behind the scenes. But, to get that sort of feedback where we would still be able to see patients and relatives could still keep in touch through virtual visiting, through iPads that we deployed, and through the remote access solution that you helped us provide and stand up, we were able to still keep providing services, which is key in a remote and rural sort of countryside area that we live in.
Absolutely. And virtual consultations as an idea as such, it's not new. I don't know for UK, but did you guys have experience with that before COVID? And what happened? Like, what was the adoption? What was feedback on virtual consultations?
Oh, that's such a good question, because had we have started the conversations around virtual consultations with our clinicians in, let's say, January, would have got the no way. There's no way this is going to be taken up. Why do we need this? Our patients don't want this service. They want to come and see us face to face on site. But obviously through COVID, we had to really limit and stop people coming on site unless it was for emergency treatment. And obviously for COVID patients. So really the only way that they could have and access those services was through a virtual consultation platform. So we had clinicians and services coming to us to say, look, we still want to provide support and exercise services to our patients. We still need to reach out to our patients. How can we do it? So we trialled a number of solutions, found one that we liked, that the clinicians liked, and actually we didn't have to do much. It sort of spoke for itself in terms of the benefits and the outcomes. And really, in terms of the transformation, I've never seen something move as fast as that moved in terms of the number of clinicians who are using it. We onboarded something like 300 staff in something like 5 weeks.
Those are amazing numbers. And actually, your story reminds me of this joke that, I think I first read it on LinkedIn and probably Twitter and other stuff, which is, and I'm pretty sure you've seen it as well. It's like this question, multiple choice question, and the question is like, who's driving your digital transformation? A, it's the CEO. B, it's the CIO. C, it's the CDO. And then D, COVID-19.
Yeah.
And well, COVID-19 definitely brought that platform, and I think that's where challenge and opportunity have met each other.